patients, it's imperative that we continue our efforts at trying to reduce incidence of lung cancer in Kentucky. We have to talk to our patients about smoking cessation. We have to ask our patients and document what their smoking exposure is. At the same time, when we're having that conversation, it's the time that we should raise the question about radon in the home. And we should ask them about that. We should ask them if it's been tested. We should ask them if they know what the result is. Because this is a risk factor for lung cancer, and it's something that we have to be able to quantify. I think it's that teachable moment that we have when a patient's in the office, either concerned about lung cancer, concerned about their smoking exposure, and the possibility of lung cancer. Hopefully they'll be asking questions about lung cancer screening if they think they're at risk. But we need to, as care providers, we need to be able to use that moment to talk to patients about all the risks of lung cancer. And radon should come up in that conversation. We want to make sure that we're going to reduce risk in any way we can, whether it's smoking exposure, secondhand smoke exposure, testing for radon to make sure that their homes are at low levels, because we're not just reducing their risk for their next cancer, we're reducing the risk of everybody else who lives in the home. I can't remember a patient who has asked me about radon exposure, but when I tell them about risks, because they'll ask me what caused my cancer, and we'll include or exclude smoking exposure, either primary or secondhand exposure. And then we'll also talk about radon. And many of them will nod their heads that they've known about radon or that they've heard of that, but most people have not had their homes tested. And most people do not understand what the risks of radon are. A student of mine who was just an observer, a high school student, and happened to be with me when we were doing a lecture on effects of a lecture on lung cancer, risks of lung cancer, and radon was included in that. She took that to heart, and she went home, said, "Dad, we ought to get our house checked for radon." And their level was over 16, and which is high. 4 should be a threshold for what we would think about as far as the risk of as being a high level of radon exposure. And so they had their house mitigated, and hopefully they will continue on with no ill effects. And to date, nobody in the family has lung cancer.